Hello, Chantel.
Hi.
My name is Brenda Olmos, and I'm a student nurse practitioner at Texas State University, and I'll be conducting your breast examination today.
Great.
Okay, I'll also be teaching you how to do a self-breast examination. So first off, we're going to start with the history. So I'm going to be asking you a few questions, okay?
Okay.
Have you had any problems with your breast recently?
No.
No? Any discharge, anything unusual, any bumps, lumps, any changes in your skin color?
No.
No? Do you notice anything around the time of your period?
No.
Okay, great. So, have you ever breastfed?
No.
Have you had breast implants?
No.
Okay, great. So, now I'm going to use a cancer risk assessment tool published by the National Cancer Institute to assess your risk factors for breast cancer.
Okay.
Okay? So, has anyone in your family ever had breast cancer?
No.
No, not your mom or your sister's first-degree relatives. No. Okay. No. Do you have a medical history of breast cancer?
No.
Do you have a medical history of ductal carcinoma or lobular carcinoma?
No.
Okay. Have you ever been told that you have the BRCA1 or 2 gene?
No.
Okay. How old are you?
25.
Okay. And at what age did you start your period?
10.
Great. You've never had children, correct?
No.
Have you ever had a breast biopsy?
No.
Okay. What is your ethnicity?
African American.
And you've never had children. What do you do for a living?
I'm a registered nurse.
Okay, so your occupation doesn't put you at higher risk for breast cancer, which is great.
Okay.
You said you were 10 when you started your period?
Yes.
Okay, so we just asked that because girls that started their period before age 13 are sometimes, as women, at higher risk for breast cancer.
Okay.
What medications do you take?
I'm on the NURS.
Okay, so I just asked that because having a little extra estrogen in your system may also put you at risk for breast cancer. But is the NuvaRing working out for you?
Oh yeah, I love it.
Okay, great. What kind of diet do you keep?
I try to be pretty healthy and eat from like all the food groups and try to stay away from the carbs.
Okay. Do you exercise?
Yeah, about 3 times a week.
Great. And then do you drink alcohol?
Yeah, I would say about 2 to 4 drinks per week.
Okay. Do you do a self-breast examination at home?
No.
Not really? Okay, that's okay. I'm going to teach you how to do it, and it's something that you should do once a month, about 5 to 7 days after your period, because 5 to 7 days tends to be when your estrogen levels are the lowest, so you'll experience the least amount of tenderness or bumps or anything like that. Okay? So what I'm going to do first is inspect just here in front of you. I don't notice any retractions, any nipple discharge, any asymmetry, or any lumps. Then I'm going to have to raise your arms just to confirm what I initially saw, which is symmetrical breast with no lumps, no discharge, no retraction. And then I'm going to have you hang your arms in front of you and lean forward. And also I see no lumps or retractions or nipple discharge or any asymmetry. All right. Then I'm going to do a bimanual exam with both my hands, so I'm just going to apply a little bit of pressure. Okay. Good. I don't feel any lumps, and there's no discharge, and the skin color looks even. Good. And then I'm going to palpate your lymph nodes, starting with your cervical lymph nodes in your neck, down to your infraclavicular lymph nodes. Then I'm going to feel your axillary lymph nodes right here in your armpit. Tell me if it tickles.
No, I'm okay.
Okay. Then I'm going to feel your epitrochlear lymph nodes right here. Good, and then let me do the other side.
All right.
Axillary lymph nodes are not palpable, which is a good sign, okay?
Okay.
Epitrochlear lymph nodes, also not palpable. Very good. All right, so I've inspected and I've done a bimanual exam. Now we're going to do the supine exam. So go ahead and lay down for me.
Okay.
And what I'm going to do is have you put your hand under your head so that your arm is above you. And I'm going to start here at the tail of Spence and feel with 3 fingers in round circular motions.
Mm-hmm.
And you have breast tissue all the way from your clavicle up into your armpit, okay?
Okay.
So when you do your self-breast exams, make sure you're checking this area also.
That's good.
And then we'll start with round circular motions downward and then back up so that we're feeling all the breast tissue. Let me know if you have any pain or tenderness when I'm doing this.
No, I'm not feeling any.
I don't feel any masses, no cysts, nothing like that. And I'm going to the other side. Put your other hand under you. Now I'm right-handed, so I'm going to reach over here, all the way from the tail of Spence, all the way up to the clavicle. And then I'll go down in a round circular motion. The nipple skin looks normal. I'm not feeling any masses. Very good. Does this hurt at all?
No.
Okay, so you can sit back up for me. And so do you feel like you could do that at home once a month?
Yeah, I think I could do it.
Okay. The reason we encourage that is because it's usually patients who find any lumps or masses before the healthcare provider. So you need to get to know your breasts and how they feel so that when there is a change, you know.
Okay.
Okay? And then if you do experience something, you should note the characteristics of it, like its size and how it feels and around what time of the month it is. And if it's worrying you, you can always come in and we can take a look at it.
Okay.
Okay.
Sounds great.
Do you have any questions?
No, you've been very helpful, Miss Brenda.
Okay. All right. Thank you very much.
Thank you.
Bye.